if you're stuck fighting chronic pain. Our next guest can help you get to that apex using breakthrough technology that'll help you live your best pain-free life.
Yes, super important. Dr. Easy is a medical director with Apex Medical Center, and he is back with us. Good morning. Well, back with us, we were trying to figure out if you'd been on the show.
Been on the station many moons
how
ago.
recently?
Yes.
It's been a bit of time.
Many years ago.
We're
maybe
happy
10
to
years.
have you.
Glad to be with you.
You are helping people manage chronic pain.
Yes.
Tell us about your relationship with your patients.
Well, I've been in town for a while, and I've been committed to helping patients deal with chronic pain.
Yeah.
I'm the medical director for Apex Medical Center, and also the chief of pain and physical medicine at the University Medical Center.
Wow, fantastic.
Yes.
So in that, several years that you've been working in this industry, the technology has come a really long way. Tell us about the latest technology you're able to use to help treat pain.
Yeah, Sean, we've had quite an improvement in technology. This is a good time, if there was any good time to.
If you're going to have pain, now's the time.
This is the time, not before. So we have a lot of improved technology. I mean, they've been invented a long time ago, but they've been so much well refined that they're more safer, they're more effective, and actually they've offered alternatives to previous opiates and surgeries.
That's the thing. It's not just throwing a bunch of
Not
opiates
just
at them and
pills.
say, here, just mask it. You want to actually get to the problem at hand. Exactly.
It's a huge
Sean.
problem, and yet we're in an age where people shouldn't have to live with chronic pain.
Yeah, yes, chronic pain is a pain. It's not something anybody likes to live in. But luckily, we have different things that we can offer now, besides, like I said, opiates. We have radio frequency methods that we can use to deaden nerves that conduct pain, thereby giving pain relief that can last up to 2 years.
Wow, okay.
We also have stem cell treatments or regenerative medicine where we can extract stem cells from you and help inject those stem cells into damaged tissue to regenerate them, build them up. So it's treating the cause of pain as its root.
It's getting your body to start working for itself.
Get it to repair itself, which is a
Can we get
natural.
those photos in here? Because I want to show, for example, it's the joints, for example, that really end up causing a lot of pain. We have one of these photos ripped right from your wall. You'll find a red spot somewhere in your office.
This is from my wall. Now, the most common cause of pain is osteoarthritis. And what happens is you begin to lose cartilage. What I'm pointing out is cartilage. This is a knee joint. I also have a picture of the hip joint somewhere. But
You've got your pointer.
Yes,
Good for you,
you see
Doug.
Yes, so this is the cartilage. It is a typical knee joint, and that's what that's what degenerates. That's what is damaged in osteoarthritis. So one way of treating that would be to inject stem cells that can help repair cartilage. They're called chondrocytes. And we can get those from your bone marrow. We can also get stem cells from your blood, and we can get them from adipose tissue or fat. And we can extract them, purify them, concentrate them, and re-inject them back into damaged tissues
this is
for healing.
Because I hear about that platelet-rich plasma. This is sort of that same idea. You're taking your own body, and you're saying, hey, pay more attention over here, fix this.
Yes, I'm going to concentrate this portion, and I'm going to put you back into tissues that have lost, that have been degenerated, that have been damaged, and then you go there and repair them. So it's really natural healing.
Would injecting stem cells be an alternative to like a whole joint replacement?
Yes, yes. In fact, one thing if you look at this, there's a lot of joint replacements done in the United States, about 1 million of them a year, and 600,000 joint replacements are knees. Now, the question is, are these really necessary? Because what happens is, when you have osteoarthritis, which is, by the way, the commonest cause of joint replacements, the cartilage is damaged. When the cartilage is damaged, sometimes a surgeon will give you a new joint. I'm going to get a new joint. But those new joints have no cartilage. So if you have a tissue that's dead 50% or 25%, is the right treatment to replace it with tissue that's 100% dead on arrival.
That are going to have possible friction, and that causes a breakdown anyways.
So the issue of replacing joints with metal or plastic is not really the alternative if there's something better you can do for it.
No question.
So, Doctor, we were just looking at a chart of a hip as well. Hip replacements, an incredibly popular procedure, especially as we come across our later years. I know my aunt up in the Bay Area had a hip replacement. Not an easy procedure to go through, and a lot of recovery afterwards. So you are looking at alternatives to those surgeries as well, it sounds like.
I think most of these knee replacements are going to become obsolete. And our children and grandchildren are going to wonder why we cut off people's joints and give them plastic or metal when we can fix or
This is going to look like
joints.
leeches pretty soon, right?
Yes, we're going to look like the ancient people eventually, I think.
If people want to reach out, the number, website right there on your screen, help people get on a pain-free path. It's great having you, Doctor. Thank you so much.
Thank you very much. My pleasure, Sean.
Good to have you.
Good to be with you.
Apex Medical Center and Spa is located near UMC off Charleston and MLK. Their number, their website right there on your screen, Apex Medical Center, a proud sponsor of the Morning Blend.